This is the right and this is the left lung medial surface. The medial surface of both the lung is divided into an anterior mediastinal part and a posterior vertebral part. This is anterior border of right lung. This is rounded posterior border of right lung. This is anterior border of left lung, and this is the rounded posterior border of left lung. You can see the anterior border of left lung containing cardiac notch and lingula. This is cardiac notch and this is lingula. So this is left lung medial surface having the hilum, which is divided into a posterior vertebral part and an anterior mediastinal part. This is again right lung medial surface containing the hilum, divided into an anterior mediastinal part and a posterior vertebral part. The vertebral part on both the lungs will be related to the same structures, that is the thoracic vertebra from C7 to T10 and the intervertebral disc, sympathetic chain, splanchnic nerves. It is this mediastinal surface, the relationship varies. First let us see the mediastinal relationship of right lung. This is the hilum of the lung. The portion below the hilum is called as pulmonary ligament. Anterior to the hilum, this is a cardiac area which is related to right atrium. Above that, the superior vena cava. Forming the superior vena cava is the right brachiocephalic vein. Arching above the root of right lung and draining into the superior vena cava. This arch above the right lung root is formed by arch of azygos vein. Behind the lung root will be the azygos vein. So the azygos vein runs behind the root of the lung, arches above the root of the lung and opens on the posterior surface of superior vena cava. Superior vena cava will be draining into right atrium. Behind the superior vena cava and the right brachiocephalic vein will be trachea and esophagus with vagus nerve, and phrenic nerve will be related in the cardiac area along with the pericardiophrenik vessels intervening between the heart and the lung, separated by the pericardium. So this is pulmonary ligament. Once again I repeat, right atrium in front of the hilum. From the right atrium, superior vena cava and right brachiocephalic vein in a straight line, draining into posterior surface of superior vena cava, arching above the root of right lung is the arch of azygos vein, which when traced behind will run as azygos vein posterior to the root of right lung. Posterior to the right brachiocephalic vein will be trachea first, followed by esophagus. Between the heart and the medial surface of cardiac area of the right lung will be the right phrenic nerve and right pericardiophrenik vessels. The vagus will be running between trachea and esophagus and will go towards the posterior side of the root of the right lung. Of the medial surface of the left lung. This is the root of the left lung. In front of the root is a cardiac impression which is related to left ventricle. Above that, this area is related to pulmonary trunk. Above that is the ascending aorta. Above the root of the left lung will be the arch of aorta, which will continue behind the root of lung as descending thoracic aorta. This is pulmonary ligament. This is the hilum of the lung. So left ventricle in front of the or anterior to the root of the lung. Above the left ventricle is pulmonary trunk. Above that is ascending aorta, arch of aorta, descending thoracic aorta. From the arch of aorta, 3 blood vessels arise. If you hold the lung like this is the arch of aorta. So from posterior to anterior, first will be brachiocephalic trunk, then left common carotid and left subclavian. Over the arch of aorta, 2 nerves will cross. The vagus will cross and go to the posterior aspect. Phrenic nerve will cross and come to the anterior aspect. Behind the arch of aorta will be trachea, which will be containing left recurrent laryngeal nerve in the tracheoesophageal group. In the lower part, the ventricular chamber will be related to the esophagus, because esophagus moves more towards the left side, towards its termination, while it is piercing the diaphragm. So left ventricle in front of the root, pulmonary trunk, ascending aorta, arch of aorta, descending aorta. From the arch of aorta, from behind forwards, brachiocephalic trunk, left common carotid, left subclavian. Crossing the arch of aorta, going posterior will be vagus nerve, coming anterior will be the phrenic nerve. Phrenic nerve will be accompanied by pericardiophrenik vessels. The vagus, after crossing the root of arch of aorta, will give recurrent laryngeal nerve, left side, which will run in the tracheoesophageal group. thoracic cage with the heart in situ with the left lung. So I am going to remove the left lung and show you the mediastinal relationship of the left lung. So I have removed the left lung. Now you can see arch of aorta giving rise to subclavian artery. This is subclavian, left subclavian artery, left common carotid. This is brachiocephalic trunk, left common carotid, left subclavian. Crossing the arch of aorta, coming anterior will be phrenic nerve, and this is vagus. Both of them will cross. Phrenic nerve will go anterior to the pericardium, vagus will come posterior to the root of lung. You can see after the arch, the vagus is giving left recurrent laryngeal nerve. This is vagus nerve going towards the posterior side of the lung root, and this is the recurrent laryngeal branch of the vagus. So this is superior intercostal vein. So the superior intercostal vein, vagus and phrenic nerve will be over the arch of aorta related to the lung. This is heart with pericardium. This chamber is left ventricle, a small portion of left auricle, pulmonary trunk and arch of aorta and descending thoracic aorta. In that order will be related. First is left ventricle, followed by left auricle. This is pulmonary trunk arising from right ventricle. Above that will be arch of aorta continuing as descending thoracic aorta. Okay. So this is the medial surface of the relationship of the left lung in front of the root of the hilum. Behind the root of the hilum, it will be related to descending thoracic aorta, sympathetic chain, hemiazygos, superior and inferior hemiazygos vein and splanchnic nerves arising from the sympathetic chain. So this is sympathetic chain, this is superior hemiazygos, inferior hemiazygos, this is descending thoracic aorta. Splanchnic nerves will be given by the sympathetic chain. Now with the heart in situ and right lung in position, I am going to remove the right lung to show you the medial surface of the right lung. So right lung is removed. That's a chamber that is related. You can see right atrium continuing as superior vena cava, which is formed by the union of right brachiocephalic and left brachiocephalic vein. So the relation will be right atrium, superior vena cava and right brachiocephalic vein. Draining into superior vena cava, arching above the root of right lung will be arch of azygos vein. This is arch of azygos vein, this is azygos vein. Behind that will be esophagus. You can see trachea. This is trachea. This is right vagus. This is esophagus. This is sympathetic chain. Okay. Right atrium. This is right phrenic nerve. SVC. Brachiocephalic vein right side. Arch of azygos vein. Azygos vein. Behind the SVC is trachea. So esophagus and tracheal groove will be containing the right vagus nerve. So trachea, esophagus, in between is right vagus nerve. This is azygos vein arching above the root of the lung, forming arch of azygos vein, draining into SVC. SVC is a continuation of right brachiocephalic vein. This is right atrium. You can see the right auricle. Embedded on the pericardium will be the phrenic nerve, which will be accompanied by pericardiophrenix vessels. So this is the mediastinal relationship of the right lung. You can see the sympathetic chain and splanchnic nerves, greater and lesser, and the C7 to T10 thoracic vertebra and the disc in between, along with posterior intercostal vessels. This relationship will be the same on both the sides. It's the mediastinal relationship that varies on the left and the right side.